Hey mama, if you have been dealing with deep, aching, or sharp hip pain during pregnancy, especially with walking, sleeping, getting out of bed, or even rolling over at night, you are absolutely not alone. Hip pain is one of the most common pregnancy discomforts that I see as a pelvic floor physical therapist. But unfortunately, a lot of the advice online only focuses on stretching. And while stretching can sometimes bring temporary pain relief, it usually doesn't address the root cause of why the pain is happening, which is why the pain tends to come back shortly thereafter. The good news is that pregnancy hip pain improves when we focus on the following: deep core activation, glute strength, and better stability around our pelvis. In today's video, I'm going to walk you through why hip pain happens during pregnancy, what your body is actually asking for, and pregnancy-safe exercises that will help your hip have less pain and feel more supported. I'm Dr. Towne, pelvic floor physical therapist, pre- and postnatal exercise specialist, and mom of almost 4. My goal is to help you feel strong, supported, and confident in pregnancy and postpartum recovery. And before we jump in, if you are looking for pregnancy-safe workouts or pelvic floor guidance, then make sure you like and subscribe. All right, mama, let's get into it. First, let's talk about what's actually happening in your body. During pregnancy, your body is constantly adapting to a growing belly and a changing center of gravity. As your belly grows, your posture changes and your pelvis shifts. Your glutes and your core often become less supportive, and the pregnancy hormone relaxin increases the mobility in your joints and your ligaments in your pelvis. And while increased mobility in pregnancy is normal, too much mobility without enough stability actually can lead to irritability in the joint and instability. This is why aggressive stretching does not help and can sometimes make symptoms even worse. Most pregnant women with hip pain actually benefit more from strengthening, deep core engagement, better pelvic positioning, and improving hip stability. And if movement feels scary right now because everything feels irritated, I want you to know that gentle, intentional movement is actually one of the best things you can do. As we go through these exercises, I want you to really stay connected to your body. Stop or modify if you are noticing sharp pain, increasing pelvic pressure, pain radiating down your leg, numbness, leaking, contractions, or anything that just doesn't feel right in your body. Remember that small range of motion is still helpful. Slow and controlled is the goal, and you should never feel like you are pushing through pain. Your body is already doing so much right now. These exercises are best for mild to moderate hip pain and work best when paired with pregnancy support wear. So I linked a few of my favorite in the caption below. So instead of chasing quick fixes, let's help your body feel supported even amidst the changes. And when we shift the focus from flexibility to stability, that's when we're gonna notice the change. All right, mamas, let's get into the exercises. First exercise, go ahead and grab a ball and find a wall or surface you can stand up against. You're gonna be in a squatted position with the ball in between your knees. You're gonna inhale through your nose and exhale through your mouth as you reach your arms gently forward and you give baby a gentle baby hug. So engaging your deep core on exhale. So inhale through your nose. Exhale through your mouth. As you exhale, again, gently hugging that baby and gently squeezing that ball to get those inner thighs engaged as well. Focus on digging your heels into the floor and pushing that low back against the wall as well. Inhale through your nose. Exhale through your mouth. Gently reach forward to position you feel comfortable Obviously, we don't want any pain here, just want our thighs, back of thighs, inner thighs working, and deep core. Couple more here. Inhale through your nose, exhale through your mouth. Gently reach forward, engaging here, and then last one, inhale through your nose, exhale, all the way out. Then slowly bring it out of that position, and we will go into the next exercise. Next exercise, we are going to go onto our hands and knees on the mat, and our hands are going to be right underneath our shoulders and knees right underneath our hips. You're going to go ahead and bend your left knee, and you're going to reach that heel up towards the ceiling. The number one mistake I see here is that people lift too high by rotating their hips open or by letting their belly sag too low and using too much of their back muscles. With this exercise, we want to isolate our glute max or back tush. So we're going to keep that knee at a 90-degree bend. You're lifting that heel up towards the ceiling, holding, and then slowly coming back down. So you're not going to lift up past a neutral position. You should feel your booty burn with this one. Again, focusing on that gluteus maximus or the back tush. Our core is engaged as well to keep that back in a neutral position. We want both our hip bones pointing straight down to the floor here, making sure, again, no rotating in those hips. All right, couple more on this side, and then we will switch sides. Make sure you're breathing here. No breath holding. All right, let's go ahead and switch sides. Same position here. Go on your hands and your knees. You're going to bring your right knee at a 90-degree angle, knee bend. You're going to drop your right knee down and then lift that heel up towards the ceiling. Bring it up as high as you can without, again, using those back muscles, without rotating those hips here. So both hips pointing straight down to the mat. Make sure that core is engaged. Again, focusing on that back tush. We want to prevent that flat booty that so often happens in motherhood, and that starts in pregnancy and carries on into postpartum. So we are preventing that right here with this exercise. All right, couple more here. Keep breathing. Nice job. All you're going to need for this exercise is a wall to help you stabilize and balance. We're going to start standing on our right leg here, leaning forward with our left foot back, and then we're going to lift the left foot up off of the floor. This is when we go into our airplane position. So left arm is extended. We're going to bring our hips open and lift our left arm up towards the ceiling. And then we're gonna switch positions. We're gonna close those hips towards the mat and then over to the other side. So drop into that hip, feeling a stretch on your right hip. Then we're gonna alternate between the two positions. So opening that hip and then closing that hip. So we're flying that airplane here. Again, using that wall for stability and balance. We are working internal and external hip rotation here, which is incredibly important for us in pregnancy, especially as we're thinking about preparing for labor. So opening that hip and then closing that hip. Almost done here, you got it. Opening and then closing. Nice work, you can drop that leg. Take a short break here if you need to. And we're gonna go ahead and switch sides. Let's bring it on up to that left leg. So standing on our left, our right foot is behind us. We're gonna start with the airplane open. So going into hip external rotation and then closing and then going into internal rotation. So try and be nice and smooth in between those positions, opening those hips up and then closing those hips. We're gonna pay attention to how this side feels compared to the other side, because there might be some differences. You might feel more stable on one leg or more unstable on one side. You might need to hold onto the wall more for stability. You got this, mama. Really focusing on lengthening through the glutes as we close those hips or go into internal rotation. And then opening up, focusing on that strength. So close here. Make sure you're breathing. All right, nice work. You did it. For this exercise, you're going to go into a wide side plank. So you can bend your hand or your elbow, your choice, and you're gonna have, if you're on your right hand, then your left foot will be in front and your right foot is behind you. Your hand is on by your ear, on your head by your ear, and you're gonna crunch your bottom knee up to your top elbow. So you're relying a lot on your inner thigh on your top leg. So crunching left elbow to right knee and then coming back up. So we're focusing on our adductor here, or inner thigh, super important muscle for us as moms. It attaches right to our pelvis. So if you need to modify this at any point, you can always drop on down to your elbow. Also, you can just hold this and drop bottom knee at any point as well. This is a challenging exercise. You're almost there. Make sure you're breathing here. Again, focusing on the inner thigh of that top leg. Nice job with that side. Let's start with the other side. So go on hand or elbow, your choice. If you're on your left hand or elbow, your right foot's forward. We're gonna crunch our top elbow to our bottom knee and then come back out. Crunch in and come back out. So really feeling our inner thigh on our right leg, stabilizing us as much as possible as we crunch and come back in. Again, at any point if you need to, drop down a level, that's okay. Bring it down elbow, or you can always drop down onto that knee as well. You're getting close. Feeling that work coming from our inner thigh of our front leg, and then also our side abs. All right, nice job. You made it. We are going to finish with a single leg sit to stand. This is such an important strength exercise for us. We are going to start by standing on our right leg. Left foot is just here to assist. So try and lean forward, pushing through your right heel, stand on up, and then slowly sit back down nice and slow under control. So we're focusing on our concentric strength by standing, and then slow, eccentric strength as we come back down. If this does not feel challenging enough, then lift that foot up as you slowly come back down, and you can keep it lifted as you stand, or again, use it for support. So you choose how much or how little that left foot is assisting you here. We're pushing through our heel and our inside arch of that foot to use the back of our hips, our glutes, and the posterior chain here. Couple more on this right side here. Feeling that burn for sure. Make sure you're breathing here as you go through the exercise. Again, use that left foot to help you as much as you need to. You can also use your hands to support you as well. Last one this side. You got it. Nice job. Let's switch sides. So go ahead and stand up. So your left foot's a little closer to you. Right foot is out extended. Just use that for stability and balance. Lean forward, push your left heel, stand on up. Again, you can bring right foot off if you want to. Slowly bring it back down. You choose how much or how little that right foot is assisting you. Whew, feeling that booty burn. in the back. The more you can push through that heel, the more you're gonna feel it in the back of that tush. That is where we're focusing, preventing the lazy tush muscles that so often happen starting in pregnancy. All right, stand that up and slowly come back down. All right, you choose your level of challenge here. Again, lift that foot off if you can. Slow, 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 slow on the way down, or use your hands to help you at any point during this exercise. So close. You got it, mama. Last one. Nice job. Navigating pregnancy hip pain can be hard, especially when it starts affecting your sleep, your workouts, and just getting through every day. One thing I really want you to remember is that solving hip pain is often less about stretching and more about your body needing stability. That's why gentle, intentional movement and the right guidance can make a world of difference. If you want more support like this, that is exactly why I created the Strong Expecting Mama program. It's a pelvic floor PT program to help you move safely throughout pregnancy, reduce the common aches and pains, prepare your body for labor, and feel stronger in postpartum as well. Click the link below to start your free 3-day trial to see if it's the right fit for you. And if this video helped you feel more supported or gave you a clearer understanding of what's happening in your body, then make sure you like and subscribe for more pregnancy, pelvic floor, and core education and exercise. And send this to another mama who's been struggling with hip pain as well, because she deserves support also. See you in the next video.